Hello everyone. I show 10:15 straight up, so I'm going to go ahead and get started so that we have plenty of time to answer your questions. My name is Terry Cumpton. I'm with the Centers for Medicare and Medicaid Services, Seattle Regional Office. The CMS is what we're called. We're responsible for overseeing the Medicare, Medicaid, and CHIP program, which would be Denali Kids Care here in Alaska. Overseeing those programs in Alaska, Idaho, Oregon, and Washington. And our office is also responsible for implementing and doing outreach and education about the new health insurance marketplace that's coming in October 1st, starting October 1st to sign up, and health insurance coverage begins January 1st. This is my coworker, Deb Sosa. Deb is our what we call the Native American contact. And so she's an expert in American Indian, Alaska Native policies as it relates to our program policies. And today, we're here. We've been in Alaska for about a week. We've been to Wasilla, Soldotna, Kenai, and we stopped in Girdwood for gas as we were driving. We spent a little bit of time in Anchorage earlier, and we're here today, and then we're flying back to Seattle tomorrow. And as we've been here, we've met with chambers of commerce and with libraries to start with, to help them help their patrons, their clients, constituents, with questions that might come up about the new health insurance marketplace. So the marketplace is what we call what some people refer to as the exchange. Some people refer to it as Obamacare. It's the place where people will be buying health insurance beginning next year. And just some quick groundwork, because what I'm going to do today is just walk you through our website, which is an excellent resource. And I have learned from the librarians I've been talking to this week that folks don't always just come in to use the computer. They do ask you a lot of questions, especially people who are unfamiliar with using a computer. So not just how to use it, but what it means, what they see there, what it means. So we're just going to walk you through some of that so that you can help the patrons that come into your facilities. But the health insurance marketplace is essentially buying private insurance on the internet, and the reason that the government is involved here in Alaska is because some states set up their own marketplace that they run themselves, but in Alaska they did not do that. So the federal government is running the marketplace here in Alaska. So we're doing that through this website called healthcare.gov, and hopefully you can all see it on your screen. If there's someone who cannot see it, can you let me know right now? Okay, terrific. I'll go ahead and get going then. I'll stop every few minutes to see if there's questions. Okay, so again, healthcare.gov, this is the landing page. Ew, sensitive mouse, sorry about that. You see up here this blue tab, Learn, and then Get Insurance. Right now we're in Learn mode because the ability to actually get the insurance doesn't begin until October 1st. As you see for this little orange banner here, the plan and cost information is coming October 1st. So right now we're in Learn mode. And people can go to this Individuals and Families button to learn more. If they're a small business, which is a large part of Alaska business, I've learned, they can go here. And then there's this All Topics button that's helpful too. And this might be particularly helpful for the people you serve because there's this part here, health insurance basics. A lot of people that don't have health insurance often have never had it. And they don't understand what health insurance is, how it works. They don't know what a deductible, a copay, co-insurance is. They hear, you know, there's a premium. Premium sounds great. No, premium is the thing you pay. So things like that, learning those kinds of terms is very important. So this is a place where folks can go and get that kind of information. There's also information on other health insurance programs like IHS, the VA, TRICARE, Medicare, Medicaid, and other private insurance as well. And then some of the other information here, how to lower costs, what happens if you already have health insurance. Because again, we're looking for people that do not have health insurance. That's what this program is for. So let me start out. You can begin two different ways. You can click on this individual and families button, or obviously the small business button, or just go right here to the green button, which I think most people are going to do, which is see your options. So we'll click on that. Oh, sorry. Hopefully we'll click on that. There we go. And the first thing that comes up is this questionnaire here. It wants some basic information before it starts giving you information. So first you can say what kind of information you're interested in. I'm looking for myself or my family, or for a small business. So let's say we're looking for ourselves and our family. I'm going to say I'm a female in Alaska, and I'm somewhere in this 30 to 64 range. Nice big range. Okay, do you have health insurance? And I'm going to say, no, I don't have health insurance, nor am I eligible for it through my employer or my family member's employer. Because again, those who already have insurance or are eligible for other insurance, well, those who have insurance, this program is not for them. Those who are eligible through a family member, there's a few nuances which will be explained as we go further. They have an obligation to purchase health insurance to avoid the penalty. You may have heard about the penalty. If you don't buy insurance, there is a penalty that comes at tax time. Okay, so again, this question. Oh.
Yeah, so I'm thinking about just recently, kids as old as 24 have been able to be covered under a parent's insurance.
Yes.
So 26. So they, should they be signing up for this even though they're covered under a parent's, or should they not?
They should not.
Not until they turn 26.
Correct. Okay. Well, as long as the parent is covering them. If the parent is not covering them, then yes, they can go and buy insurance here. Okay. But if the parent already has the kid on their insurance, they don't need to do this. Okay. Again, if you have health insurance, this isn't for you. Although I should say that some kinds of health insurance, like if you just have AFLAC, that's not actually insurance, health insurance. You know, it's a catastrophic coverage thing. It doesn't cover regular
dental appointments.
Yeah, doctor visits, hospital care that for a broken leg where you're in and out. Okay. All right. So again, we're going to say that we're not eligible for health insurance through a family member, and we want to say, yes, I want to find out information. And then it says, am I dependent under 18, self-employed? Do I have a disability? Do I want information on pregnancy, being a veteran, American Indian, or Alaska Native? I'll check the Alaska Native. And it wants to know if I want additional information about pre-existing conditions. Because beginning in 2014, insurance companies cannot deny you based on a pre-existing condition. Not just insurance companies through the health insurance marketplace, but any insurance company cannot deny you coverage for a pre-existing condition. So if they've turned you down in the past, or your spouse down in the past because of a heart condition, that they can't do that anymore. Okay, I'm going to say no, I don't have any pre-existing conditions. Oops. And get down to the green button here. Next. I'm just going to be one person. And then it wants to know, will your total household income be below or above $60,278? Because I'm just one person. If I would have changed this to more people, you see the number goes up as I add people to my household. So let me go back down to 1. Oops, 0. Here we go, 1. So in Alaska, you can get assistance paying for your health insurance through what's called a premium tax credit. If your income is below around this $60,000 number. So I'm going to say I'm below that. And then you can see here on the left that I've answered, these are the answers to my questions, or how I answered the questions. If I want to change them, I can by clicking on the edit button, or I can click on this start over and begin again. Here it's giving me information on, because I answered that I'm an Alaska Native, it's giving me special information about me. You can click on this and drill down and find out additional information. It's giving me information about Medicaid because I indicated that my income was below that $60,000 level. So it's going to give me that for now, and then it's also going to give me information on how to lower my cost on the marketplace coverage. If you scroll down, it gives you kind of an FAQ based on my answers to those questions. And again, you can drill down and get additional information. And then if you go a little bit further down, you can create an account. Now, I know a lot of people don't like to create an account on an internet site, especially in a library where it's a public site. We encourage people to do that because it will save your information. The next step, beginning October 1st, applying for health insurance through the marketplace is a two-step process. So there's a step where first you do an eligibility application. You give some information to find out if you are eligible for health insurance, if you're eligible for premium tax credits that save you money on paying for it, and if you're eligible for Medicaid, for example, if you're eligible for other cost savings programs. So that's one application. After you get through that, it tells you what you're eligible for and how the not assistance, that's the wrong word, the tax credits and so on that you're eligible for. And then you go to a screen where you actually sign up for a health insurance plan, where you'll see the plans available, how much they cost, how much it will cost for you based on the tax credit you get, and that kind of thing. So if you do the first part and then bail out, it won't save any of your information unless you create an account. So we're hoping people will, because it doesn't save it on the machine that you're on. It will only save it to the account that you create. And then also, are people allowed to print?
Yes.
Okay. So they can print their little checklist that they just made that will help them prepare and get information, save their information for them in printed form. You can also print the whole screen up here on this button if they want to stop now and then come back later. So let me stop now and see if there's any questions.
There's one in Hollis.
Thank you. Okay.
And this is Doherty Carter. I'm curious, what if they put all the info in and then they create an account with that information and then they choose to change their information? Does that just change the information for their account? Can they go back and change their info on the little checklist to create, for instance, a different scenario to see what that says and have that applied to the account they have, or do they have to create a new account?
No, they don't have to create a new account. Once they set up their account, they can go in and edit information because one of the things that you're doing is you're putting your income information in there. So in Alaska, for example, where there are a lot of self-employed people, let's say, or especially seasonal workers, for example, where their income really varies. So in October, when they're first doing this, they're thinking, it doesn't look like a very good year. This last year, 2013, was a bad year. I think my income's probably going to be $30,000. So then by December, all of a sudden, it's a boom year. Let's say they work at a ski resort or something, and it's been a great year, and they know they're going to be doing better than $30,000. They should go back into their account and change their income level and look at the new scenario, because the amount of premium tax credit they will get will change. It's income based, so the lower your income, the higher a tax credit you get, and the higher your income, the lower the tax credit you get. As far as changing the little checklist here, you would have to go back and start over and do that also. But again, it doesn't ask specific information the way the create your account will once you get that eligibility application. Does that make sense?
Yes, it does.
Okay.
Are you going to be covering at any point when, for instance, if you have a husband and wife that are not covered, but their children are covered by Denali Kid Care in Alaska, what that family should do?
Yes. Well, I wasn't going to, but I can. I was pretty much just going to walk through the website, but just to answer that question, since we're on it right now. So if the parents are not eligible for Medicaid, or they don't have insurance through their employer, then they will need to buy insurance through the marketplace, or they will have a penalty at tax time. Their kids stay on Denali Kid Care. Their kids are counted as part of their household when they fill this out, the number that we change from 1 to 4, and we watch the income change. They're still in their household, those kids, and they stay on Denali Kid Care, but the parents would need to buy insurance through the marketplace.
So then when the parents get coverage for themselves, they would say that they live in a family of 4, even though their kids are getting coverage by Denali Kid Care.
That's right, and they're buying insurance for 2 people. It'll ask them additional questions. When they say they have kids, it'll say, do the kids have insurance? And you say yes, they're on what we would call CHIP, that they have that, but they're still in their household, and those kids are still dependent on them. They're still their dependents. So this is kind of driven by from a tax mindset as far as that's concerned. So if you claim them as a dependent on your taxes, you want to count them here.
Thank you very much.
We have a question.
We did have a,
Go
ahead.
We have a question here at Mountain View that's sort of a follow-up.
Okay.
On households, your adult children can't find work due to the economy. They move back home because they can't afford to live. Do they become part of your household, or do they still count as their own entity? Also, a elderly parent having to move in with you, they're already covered under Medicare and everything, but does their income and them count as your household now too and bump you up and cost you more money?
Okay, so again, it's tax driven. So if that kid who's moved back with you, or the elderly parent who has moved back with you, can be claimed as a dependent on your taxes for tax purposes, then you would count them here. So that's the dividing line. And I don't know, sorry, I don't know enough about taxes to be able to answer that from a IRS perspective. I'm sorry. Okay, and someone else had a question?
I'm from Nenana.
Uh-huh.
Okay, and I had a question. Now, if you're 26, whose responsibility is it to put them on the insurance? Is it the parents, or I'm kind of confused about that.
So for kids under 26, you can put them on your insurance. You don't have to, but you can. So that's what the Affordable Care Act changed. It used to be that they had to be a student, or they could only be a certain age, up to a certain age, up to 18. But now it's any kid up to age 26, so actually through age 25, they can be on your insurance. If you don't put them on your insurance, they can buy insurance through the marketplace. So if you've got a 22-year-old kid who's working at the coffee shop but living at home, and you don't want to cover them or aren't able to cover them on your insurance for whatever reason, then they can buy and must buy, well, if they want to avoid the penalty, insurance through the marketplace.
Okay, here's another question. Where it says, are you eligible for insurance through an employer or something like that? If I'm eligible, but I can't afford the family, then can like my husband get off and say I'm not eligible?
I'm not sure I understand.
So you are employed, and
Yes.
but if you can your employer is covering your premium for your health insurance, but you want to add your husband and children, but that's too much money.
Yes.
Then they can go on the marketplace and get health coverage.
When they go on the marketplace,
It might.
do they say I'm not eligible for insurance to ask them they're eligible through an employer?
Yeah, it will ask them if, if they're eligible for insurance through, a family member. I don't know if you remember that question down here on the checklist. It will ask that, but the dividing line is, and this is probably a level of detail you don't really need quite yet, but the dividing line is if the insurance costs more than 9.5% of your income, if, insuring your whole family through your employer plan costs more than 9.5% of your income, that's considered unaffordable. And so that means that now your spouse and kids can go on the marketplace and buy insurance, and there's not ramifications for your employer. So there's still, because employers, if they don't make the insurance affordable for their employees, then there are ramifications for them, financial. So they would still need to go onto the marketplace and buy insurance, and it would ask them the questions about the affordability part. Does that make sense? So it'll ask why, are you eligible? Yes. Then why aren't you getting it? And we haven't actually seen it yet because it's not live on October 1st. But on a paper application, it talks about that on the paper application. I got to believe it's going to be on the internet as well. So, does that help?
Yes.
Okay.
I have one more question.
Okay.
Where you saying that you get a tax credit if you can't afford it? When you have to pay taxes.
Tax credit. Oh, I see. Yeah. Are you taxed on the assistance that you're getting, so to speak? No. The way that it works is like regular tax credits. So it's, sort of like regular tax credits. So at the end of the year, when you go to file your taxes, you get certain write-offs and you get certain credits depending on what you've done. Maybe you have a mortgage, maybe you bought an electric car, or you got new windows, or whatever it is that you get credits and write-offs from the government. So you put all that in there, and those are, that goes into the amount you owe or are refunded. However, on the way the premium tax credits work in the health insurance marketplace is that if you are eligible, let's say you're eligible for $1,200 a year in tax credit. That's $100 a month. So every month, that money will be sent to the insurance plan that you picked. So if you picked a plan that's $200 a month, the government will send $100 a month to that plan that's part of your tax credit, and you pay the other $100 a month. Then at the end of the year, it's all reconciled. If you don't want to do that, you don't have to do it that way, but you would be paying the whole $200 a month, each month, and then at the end of the year when you do your taxes, you put the $1,200 tax credit in there, and that would either give you a refund or, whatever, would work like that, okay?
Well, usually when you get a credit, it's based on you paying taxes. So like for me, I have enough dependents and my income's low enough that I don't pay any federal income tax. And so getting a credit, it wouldn't really work with it.
Well, it would still go, again, I'm not a tax person at all.
So
This is a tax question.
Yeah, you need to, you should ask the IRS that one. I don't know enough about taxes, I'm sorry, to be able to address that.
So are your children covered?
Through Denali Kid Care.
But you aren't covered.
I'm covered through my employer, but my husband is not covered at all.
Okay.
Okay, were there any other questions before we move on? Okay, so
I'm sorry, can I have one clarifying question?
Sure.
If you can get health insurance through your employer, are you required to go through your employer, or can you go through the marketplace?
If you are eligible for insurance through your employer and you don't buy it and you go to the marketplace and you're eligible for a premium tax credit because your income is below the $60,000 and change, your employer is penalized. If you are not eligible for the tax credit and you choose not to get your employer's insurance for whatever reason, you can do that. You can do that. No ramifications anywhere.
Okay, thank you.
Mm-hmm. Okay, a couple other things I want to point out real quick. See down here, there's this live chat button. At any time, like on other websites, consumer websites, you can click on that live chat button and chat with a representative in the Marketplace call center. Okay, here you'll see, I scrolled down, we got these other FAQs down here. Oh yeah, we already did that, that's right. So let me go down here to the very bottom where it says, was this helpful? You can click yes or no. If you click no, it will bring up a box where you can type in why this wasn't helpful. It didn't have the information you want. It didn't work properly. Bad navigation. If you put that in there, there is a person, her name is Maria Mazzoni, and she's in our Baltimore office, and she reads every single one of those and passes them off to someone to be fixed. So just so you know, they do actually get read, and something happens if you put information in there.
When you go live, will it still just be one?
I don't think it will. I was going to, that's funny. So the question was, when it goes live, will it still be one person? I talked to her just last week, and she's a great person, full of energy and really terrific. And I thought, I wonder if I call her on October 30th, what that'll be like. So we'll see. No, I'm sure it won't be just one person anymore. Okay.
Is it okay to ask you a question, or I can wait?
Yeah, go ahead. Go ahead.
This again is Doherty and Hollis. There's a unique kind of situation in Alaska that probably happens other places as well. But for instance, you have small business commercial fishermen, for instance, such as my husband and my family, and we don't always have a deckhand. We don't always have one, but sometimes we'll have one for maybe 3 weeks out of the whole season. So you have these kind of interesting conundrums where we have to buy insurance just for that period of time for them on our boat. That's insurance if they, have an accident and it covers the process thereof of what has to happen. But so technically we're the employer, but we don't do W-2s, we don't do anything like that. We fill out a 1099 miscellaneous at the end. So it's almost like we're contracting them. So
Yeah.
I'm concerned if we're not considered employers then. And I mean this for other people, not just myself, because there is this scenario for other people. So am I correct on that?
That's correct. You are not an employer if you're not giving them a W-2.
Okay, great. Thank you.
So they should be buying their own insurance.
They should be buying their own. With both she probably has insurance through her employer, but maybe her spouse should be buying insurance, and obviously the folks that come and work for them. Okay, so now let me run over here to small business. A little bit slow today. Sorry. There we go. It basically looks the same, as you can see. It's set up generally the same. Has the see your options. There's a little video here you can watch too, if you like. And if you scroll down, again, scroll down, there's these great FAQs here. What is this SHOP, which is Small Business Health Options Program? What if I'm self-employed? Do I have to insure my employees? What if I have over 50 employees? Can I use an agent or broker? Because a lot of employers do use agents and brokers as kind of an HR, so to speak. So there's FAQs there. You can point people to those to get answers. Again, the live chat. I'm not going to go through the business one, but it is there. Oh, also, I should have pointed out down. Go ahead.
Go ahead. So that small business, is it, for instance, my husband and I run a small business commercial fishing, but we don't, again, like I said, don't have employees because we contract out for a deckhand. Do we go to that spot to get insurance for him and himself and myself? Because I don't have insurance through my business. That's not where okay.
That would be, you're a sole proprietor, so you have to have at least one employee to purchase through this Small Business Health Options Program.
Okay, thank you.
Sure. Okay, so there's that information. Down here, you'll notice there's a call center. Here's a call center number that is for the SHOP. If we go back to the individuals and families, it's a different call center for individuals and families. The SHOP one is only open till 5 p.m. Eastern, you may have noticed there. The individuals and families, the main call center is open 24/7. So you can call anytime. There are many languages available. They're working on getting UPIC added to that as well. There's 144 languages right now. Hopefully there'll be 145 soon. We get a UPIC speaker. Also, you can take the whole website, hit the Espanol button up here in the corner, and as soon as you hit that, it will take the whole website, and it actually takes you to another website, to our Spanish website. Still chugging. There we go. And everything is in Spanish, including the little videos with the poor woman with no feet.
Can I ask a quick question?
Sure.
Okay, that live chat, is that a text-based chat or a voice chat?
It is text-based, so and the chat is only available in English and Spanish. You can request through the call center for assistance in another language, but right now it's going to be voice only.
That answers, thank you.
Alrighty. A couple of other things I wanted to just talk about quickly before we have to end. Well, first, are there any questions from here in the room?
Well, one of the things, and you've probably heard this before from other libraries, is we're very restricted on the kinds of information we can give out. We're not allowed to give out medical advice, legal advice. A lot of this is falling into that ballpark. So we can certainly get people set up on here to start putting their information in, but we're very restricted on how much we can help.
That's exactly right. You have to put on the brakes when you get there.
Mm-hmm.
The reason we're only walking through this and we're not doing a full-on marketplace presentation, although we're answering the personal questions for people's personal lives, but their own personal questions, but to address what's happening in their life. Yeah, you would definitely put the brakes on. This is just a tool to point them to,
Okay.
and then refer them to the call center, refer them to the chat. Maybe help them find an FAQ. Say, well, there's did you scroll down? Did you scroll down? And remember to click on, the blue highlighted sections to find more information. That's really all you can do.
And will there be bookmarks, flyers, any kind of paper information being sent out when this is getting closer to time?
Yes, so this is what the libraries have all told me so far. They are saying that they really need paper, that you like paper.
Our patrons like paper.
Your patrons like paper. So can everybody still hear? I know there's somebody not on mute right now.
I have a follow-up question to James' question.
Okay.
What is the average length of time to fill out this, being that most of us have computers that we only allow users to, say, use an hour, 45 minutes, etc. at a time?
Okay. The first phase, the eligibility application, really all of it depends on your family size because it will prompt you for more information. If you're a single guy and you don't have any dependents and you don't have a very complicated life work-wise, you have one employer, it probably isn't going to take you very long at all. I filled out the paper application that's in draft form right now. It's not the final one. Filled out the paper application as if I was that person, and it took me about 15 minutes, but I knew what all the terms meant. So let's say 20 minutes, 25 at the most, the very most in that situation. Then I filled one out based on my own situation, have a dependent, have maybe a little bit more complicated life. That still only took me 20 minutes.
But you know how to use a computer.
Well, this was on paper. I was doing it on paper where it's even more complicated.
Okay.
So on the
You
computer,
know how to write.
on the computer, what will happen is if you noticed when we were going through the checklist, it was kind of like a question per page. The idea is to make it as easy as possible that way. So yeah, I mean, it's hard for me to tell. It really is. It depends on how many dependents they have and how complicated their life is. It's hard for me to give you an answer. I'm sorry. The next part about enrolling in a plan, that will take some time. People are going to have to noodle on that because there are different plans to compare. There's two companies, you probably have heard, there are two companies that are going to be offering plans in Alaska, but each of them will have multiple plans. There won't be just one from each, so there won't be just two choices. There's multiple plans to choose from. So you're going to need to, people are going to need to look at that and figure out which one is the best for them. They're in what we call metal levels, gold, silver, bronze, platinum. All that means is the size of your out-of-pocket expense, co-pays, deductibles. So it's hard for me to say that, but that part will take a little bit longer, which is why creating an account is really important. If you do it on paper, getting back to the paper question, so you may have noticed as we were going along, pretty much every page you're able to print this little imprimer here on the Spanish side. That was a terrible accent, wasn't it? And then on the English website, print. You can do that on any page, so they can print what they're looking at. And then there will be a paper application available, but I don't know if it's going to be like a government form where you put, you order the form number and they ship it to you. I don't know if that's what it's going to be yet, or if it's downloadable online only. I'm not sure about that.
I'm thinking at this point, what we'd really want to have out are bookmarks or some kind of sign that just says, people, this is coming, you have to do this, and be passing these out to folks ahead of time.
So, so I brought a couple things with me, a couple of flyers with me, and these are available on our website. You can order them. But also, recently, you may have heard that ANTHC, the Alaska Native Tribal Health Consortium, and the United Way received grant money from the Department of Health and Human Services to do outreach and education to people about the program. They just received their grants on the 15th, so they are getting organized, mobilizing, getting their folks ready for action, and I imagine you will be hearing from them very shortly. I expect that they will stop by with this and more materials, as well as perhaps beg for a place to talk to people here one-on-one. And hopefully you would be able to do that, offer some education for folks in your facilities as best you can. But yes, there will be plenty of paper. We're the government.
What was the name of the organization you were just discussing?
That's going to do the outreach. So it's the United Way. They are going to mostly be focusing on metropolitan outreach in Alaska, metropolitan areas. And then the Alaska Native Tribal Health Consortium, their focus, or ANTHC, their focus is on rural Alaska. And honestly, I do not know what defines rural in Alaska. Being from Seattle, pretty much anything outside of Anchorage feels kind of rural to me, but it might not be.
It's where you have to fly to.
Where you have to fly to, okay. That's easily understood. Okay, so.
Quick question from Mountain View.
About me?
Are Alaska Natives who are eligible to use the tribal health, are they required to also have a health insurance plan beyond going to the tribal health areas?
The answer is no. They are not required to, as long as they are able to show that they are an enrolled member or if they are descendants. So if they're using IHS services, pretty much the clinics can help them differentiate that. And one of the challenges is going to be is that because of the way the law was written, we have an issue with the definition of Indian. And so there's a difference between those that are enrolled in their corporations or tribes or villages. They're eligible for all of the exemptions and tribal provisions in the marketplace. And those that are just descendants and are not enrolled with their tribe or corporation, they're not able to access the Indian provisions in the marketplace. So they will have premiums, and they will not be able to have monthly enrollment.
Okay, so, and I know this had come up before. Personally, my husband is Native, and some of his relatives work for the Tribal Health Corporation. So if you are enrolled as a shareholder, but not enrolled in the tribe, but if you're a Native corporation shareholder, that will count as eligibility.
Yes.
Okay, thank you.
I have a question here, Hollis.
Sure.
Will it, once they put all their information in, and they create an account that shows them what their tax credits would be and such, does it somewhere in there also show them if you don't buy insurance, this will be what your penalty would be based upon your scenario come tax time? Because I see that as a question we might get asked, which of course we're not supposed to answer because we don't know. But does that site help them out with that?
Yes, I don't know exactly what it's going to look like. Today, the way it looks is there's an FAQ, if I can flip back to the English site here. There's an FAQ on there, frequently asked question on there that talks about what if I don't buy insurance. That does talk about that, about the penalty. It doesn't give the amount. It just says that there's a penalty, and then you have to drill down to the IRS website to get the information on the amount, because it depends on your income circumstances. So as Deb was just saying, there are certain natives who are exempt from paying penalties, but there are others who, if they're not enrolled or shareholder, they could be penalized. So, for the first year, for 2014, if you're not enrolled by March 31st, that's how I was going to close, by the way. Enrollment October 1st to March 31st. If you enroll by December 14th, your coverage begins January 1st. So if you're not enrolled by March 31st, then the penalty is, for 2014, it's $95 or 1% of your income. So if you make $10,000, it's going to be $100 will be your penalty, obviously. Then in subsequent years, that amount goes up until eventually, right now, it would reach $695 or 2% of your income. And again, right now the site takes you to the IRS site for that information. But yes, there's a FAQ on what if I don't buy insurance. Does that help?
It does, thank you.
Okay.
Can I make a note for my fellow librarians? If the deadline for this is March 31st, that's also PFD deadlines, and we need to think about what our computers are going to look like between March 20th and March 31st.
What is PFD?
The permanent.
Love you all.
Love you all.
We're just going to close the library. If you don't have it done by then, that's too bad for you.
She says with great love in her heart. Okay, so again, this is just the beginning, and we really, really appreciate you taking the time to hear about the resources available today. Again, thank you for your help as well, and for all the work you do, and be prepared. Like I say, I know you will have folks getting in touch with you from United Way and ANTHC and their coalition of organizations also asking for your help. Thanks again.
Yeah. And I was going to just add one little piece, is that if you do have anybody that's native, there's one of the sites on here has a page of not just frequently asked questions, but very specific information about that nuance between an enrolled. And so if you just put the healthcare.gov and do a / Indian or tribal, what did you call it? Tribal, it'll bring you up to that page.
Okay.
So.
Can I just want to, oh, sorry.
Sorry.
Go ahead.
Go ahead.
I'm sorry, I wanted to clarify. I was writing while you were talking about the deadline, and I don't want to make some flyer that says the wrong thing. So again, you can begin looking on October 1st on this site, but you must buy insurance by March 31st of 2014, or you will be penalized. Is that correct?
That's correct. And, well, yes, there's one little nuance. If you buy by the 14th, so after January 1st, actually after December 14th, when you buy the 15th or later in a month, it starts a month and 2 weeks later. So if you buy by the 14th, it'll start the first of the following month. If you buy the 15th or later, it's a month and the whatever days you missed in the month. I'm saying that terribly. Does that make sense?
It does. Thank you.
All right.
All right, any last questions? Here in the room? All right, thank you very much. We appreciate it. Bye-bye.
Thank you.
Thank you.
Thank you.
Thank you.
The American Indian.
Thank you.